Top Med Talk.
Well, hello and welcome to Top Med Talk here at Anesthesiology 2025. We're in San Antonio, Texas for the American Society of Anesthesiologists annual meeting. I'm Desiree Chappell. I'm your host and co-editor-in-chief. I'm joined by my co-editor-in-chief, Mike Grocott.
Good morning, Desiree.
Mike, for some of our listeners that may be watching for the first time, can you just tell us a little bit about yourself?
So I'm chair of anaesthesia in Southampton in the UK, so on the south coast of the UK, and I run a big research centre there for our National Institute for Health Research.
Fantastic. So Mike and I have been doing Top Med Talk for many years here at ASA, the annual meeting. And one of the highlights every year is to have a chance to catch up with the incoming and outgoing presidents of the ASA. So this morning, we are so lucky and privileged to be able to sit down again with our presidents. We have Dr. Don Arnold. Don, thank you so much for joining us again.
Pleasure to be here.
Yeah, you're in the hot seat again. We got you back. And then we have Dr. Patrick Giam. Patrick, thank you so much for coming on today.
Yes, thank you so much for having me here today.
All right. Well, we have an international audience from around the globe. So for our listeners, Don, I'm going to start with you. Why don't you tell us a little bit about yourself, your practice, and how you got into this role?
Well, great. I'm an anesthesiologist in general practice and clinical practice in St. Louis, Missouri with Western Anesthesiology. We are a practice that provides services to the Mercy Health System. I have been there for 30 years in a really dynamic clinical practice environment. I think the other part of the question was how I got involved and what I'm doing now. And probably, honestly, I was probably insufficiently self-aware of what was happening to me, the opportunities I was being given, the mentors and sponsors who were giving me opportunities early in my career to expand my involvement beyond just clinical practice, getting involved in the ASA and the American Board of Anesthesiology, and with progressive opportunities and individuals trusting in me and giving me additional opportunities to serve. There's kind of a natural progression through committees and through other areas of the governance.
Yeah,
So
and I think I remember you saying that it was wanting to contribute back and give back to that.
Exactly,
Yeah.
exactly. And I think that's a key part of professionalism as a physician, is looking at the profession as a whole.
Yep.
And what can you do to create an environment of practice, to create a healthcare system that will continue to improve? And a lot of that is supporting the next generation at this point, right?
I think we'll talk a little bit more about that in just a moment. Patrick, how about you? Why don't you tell us a little bit about your practice, where you're from, what kind of anesthesia, and then what led you into the roles here within the ASA?
So I'm a physician partner with U.S. Anesthesia Partners, big national practice, and I work as I have my whole career in Houston, Texas at Houston Methodist Hospital. Most of my practice has been centered on neuroanesthesiology and also liver transplantation, so I'm kind of a big case guy. I trained in cardiac, but a long story, my practice got away from doing a lot of cardiac, so I've gravitated to other cases like neuro and liver transplantation. I got involved with organized medicine many years ago, before our current large practice, and even before the one before that was large. Very early in my career, I was mentored and introduced to our state component by an anesthesiologist senior partner who had been an officer in the American Society of Anesthesiologists, was a board examiner, was just so involved. And he said, this might be something that would appeal to you. And I got involved with it, and I discovered that it was not only extremely valuable for learning what was going on, but I developed some great friendships in the Texas Society of Anesthesiologists. I learned very early on that while the work I was doing clinically was very rewarding, very helpful, that was really sort of one patient at a time. But being involved in organized medicine gave you the opportunity to have even perhaps a bigger impact where what you do can affect populations of patients, and found it very enjoyable and rewarding.
It's very inspiring to listen to both of you talk about the mentors and the people who helped you along the way. Like now you're the boss, or you both in turn being the boss. How do you manage succession and bring new people through, new blood into the organization?
Well, what we find is you have to be intentional about it. So if you just let things happen spontaneously, some of that will happen spontaneously. But if you set up a process where you identify people who have talents and particularly who have interests in doing things outside of the operating room, then you find that cadre of folks who would be interested in doing organized medicine or contributing in another way. And that's what we seek to do. We seek to identify people and also let them know the opportunities of what's available outside the operating room, because a lot of times they're just not aware of what can happen outside.
Great.
Michael, I'd just add that ASA has done some work to develop mentoring programs because some departments, some practices have wonderful internal mentors in terms of developing careers and developing engagement in professional society activities. Others, perhaps not so much. So we have a program that identifies those individuals interested in serving as a mentor and those individual ASA members who are seeking a mentor and putting them together in a way that supports individuals who want to give or contribute in those kind of ways. We think that's important, and ASA has leadership resources that we make available not only on the national level, but expressed through the components, because the component societies are really where the development of the next group of leaders nationally are coming from.
So that's the typical path is up through a state level organization and up to the national ASA.
Typically,
leadership. Yeah. Thank you.
Last year, whenever Dr. Harder was handing over to you, Don, I know we were talking a lot about headwinds and the things that were issues last year with payments and billing and then the economic piece of anesthesia. There are a lot of things that you were really excited about. So tell us, what is some of the proudest moments for you over this last year? And what do you feel like are some of the big initiatives that you're working towards, and how did they go?
Yeah, thanks. That's a big question. I think one of the things that I'm really proud of is how we have, as a leadership group, identified priorities for ASA. We've identified 4 core strategic priorities that we think are essential to evolving the arc of the profession in a positive way over the next 3 to 5 years. ASA is just brimming with talent and the capacity for innovation. But I think what we have done this past year is provide a structure that prioritizes areas that are critically important. And then we channel that work in advancing anesthesiology care with an emphasis on quality safety, on outcomes, patient and provider interactions, and efficiency. That's one of our priorities. Second priority is increasing visibility and voice of the profession, which is critically important for the advocacy we need at this point in time. Third is advancing the understanding and adoption of new technologies. And there's an explosion. I'm looking around the
I
exhibit
was just going to say we're here.
of new technologies, and finally work that is really foundational to ensure the economic integrity of this specialty. So these are the 4 areas that we've prioritized and tried to express work. And I think how we've executed on that in a really dynamic time is probably what I'm most proud of.
Yeah, that's great. I know over the last year, it was really exciting to hear a lot more about the Center for Perioperative Medicine. So Top Men Talk is a perioperative medicine podcast, and Mike and I and the whole team are really involved in the promotion of this space. So can you tell us a little bit more about this?
The Center for Perioperative Medicine, frankly, is the first initiative under our first core strategic priority, which is advancing anesthesiology care. ASA is serving as a foundation for organizations to improve understanding, awareness, and the ability to implement perioperative medicine principles. A year ago, we met just as anesthesiology societies, both within the United States and internationally. This year, we had a summit on Friday, and we were really pleased with the number of surgical societies that are now participating as well. We believe that there's a lot of momentum in this space, and we think fundamentally there's the potential to reshape care delivery in the United States, improving outcomes and improving efficiency of care. Pat?
Yeah, I think that is one of the big roles and the opportunities for big societies like ours, to bring together other stakeholders, other organizations on a common theme and common issues. In this case, it's perioperative medicine, which is certainly critically important, but we can also bring them together on other economic issues or advocacy issues, and the ability to bring in these wide, disparate groups that work focused on things which help our patients and our specialty is very important for ASA.
Yeah, I mean, I was there on Friday afternoon, and that convening power of bringing together surgeons, and I think you had some internal medicine specialists and hospitalists, and the mood music felt very positive. I thought you did a great job.
Yeah, that's great. Well, Patrick, as we are going forward and you're kind of carrying the torch now, and or on as of Wednesday, you will be carrying the torch forward. Don's done such a wonderful job this year. What are some of the initiatives that you are going to be really passionate about to continue forward?
Yeah, well, we're going to stay the course on a lot of the strong strategic agendas, much of which Don laid out. One other thing that I want to focus on is we do a lot of things as anesthesiologists and in the American Society of Anesthesiologists, but I wonder if all of our members are aware of the multitude of things that we're doing. So I'd like to help them understand what we're doing, how we're addressing it, how they can be involved, part of the member value equation. So one of the things I'll be focusing on in the coming years is making our communication style match our effectiveness out in the real world, but so that members can see it. So we'll be trying different communications means and different communication styles to help reach members in a way they want to hear and in methods they can hear it. So what might that be? We're going to have more frequent communication from the society, but shorter, more bullet point highlighted documents that hopefully they can get through, even if they're busy in between operations or driving home. So we're going to have more of an emphasis on video and social media. And we've seen the power that social media can have back even when we were having the discussion with Anthem on limiting anesthesia payment for time-based reasons, which we thought was, of course, unreasonable. We found that the social media aspect really helped become a tipping point and a strong advocacy lever for us to help the public understand that the issues that we face as anesthesiologists and physicians are not just unique to us, but also affect them directly. And so we'll be looking to those methods for communication.
Yeah, that's great. It is always so hard to reach those frontline clinicians and constituents, and a multimedia, multimodal approach, just much the same way that we treat pain is how we need to treat communication. Both of you have, and Don now through the past year, have had insight and a look into this organization that very few have. From your perspective, what do you see are some of the most exciting the most exciting trajectory of the ASA, and what are you most excited about for the profession?
Yeah, well, I think probably a couple of things, and it begins with people. Just the unbridled potential of the American Society of Anesthesiologists is expressed through our engaged members who are on a day in, day out basis at the bedside, at the bench, in education, in leadership roles, really having dramatic impact in their facilities, their health systems, and the communities where they're providing care. So I think the people. I think the second item is somewhat related, and that's the explosion of interest in our specialty. Much greater interest and a very high fill rate in anesthesiology residency positions, but at the same time, an expansion in the number of nurse anesthetists and certified anesthesiologist assistants coming into the field.
Yeah. Yeah, it is very exciting. I hope that we'll get to over the staffing crisis and be able to deliver some just amazing, amazing care, which we already are doing, but it's going to be nice to not feel the strain of do we have enough people to fill the seats kind of thing.
Yeah, it's interesting as we continue to look at the workforce issues. While there's been an increase in the number of providers, what's happened, of course, is just a dramatic increase in demand for our services.
Yeah.
So one of the areas where we think anesthesiology can speak into the need for both efficiency and use of facilities from an optimization point of view, from an economic point of view, is really help facilities and health systems use their resources more wisely.
We've had lots of conversation about that. Like,
So, yeah, I wonder if I could throw in a slightly speculative question. One of your pillars, I think, was innovation or harnessing new technology. How do you think that plays into the workforce story?
There's sort of two pieces of what we're looking to do in technology, and Pat really hit on one of them, and part of it is connecting with our members a little more effectively, where we think that there's an opportunity to express best practices and toolkits that will help. I think that we will see an increase in artificial intelligence as it relates to scheduling and prediction of clinical care needs. Several examples of that AI application in predicting demand for services in the exhibit hall that I've seen. So I think that's an area.
Patrick, what do you think about this? I mean, this has been an interesting topic again that we've covered on Top Men Talk extensively, and it's all about engagement with the technology, right? We're sitting in the middle of this exhibit hall. There's a lot of new. So, what are you thinking about as you go forward? How do we improve the engagement with the tech that we're using in embracing this AI?
Yeah, I think AI will be a game-changing force. So I did an interview once where they asked me, what do I think the future of AI will be? And I'm thinking that it must have been when they asked somebody, what do you think the future of electricity will be? I think it's difficult to anticipate what directions it's going to go, but I think we're very excited for it. But we would view it more not as just artificial intelligence,
Oh, yeah.
but maybe augmented intelligence. Maybe the AI helps bring in the massive data streams, which we're responsible for and need to analyze on a second by second basis, and helps us bring that into a readable form where we can create knowledge and information to help drive our real-time decisions. So I think that can help clinicians supplement their understanding of what's going on and even take these information granules from one patient, add it to thousands of patients, and create understanding of what might happen in populations. So that
Yeah.
we take a patient with having this operation with these comorbidities in this center, and what kinds of things can we do to personalize care to make their journey a little bit easier and safer. So I think these are opportunities that we could see right off the bat for augmented intelligence. And I think the future is very high for that.
And, I want to just put an advertisement for the Rovenstein lecture
Yes.
that Pat and I just came from. Sachin Ketterpal, who is just an incredible thought leader, gave a really wonderful summary of the future of anesthesiology in a data-driven world. And for those who weren't able to be there, I'd encourage
It gets published.
individuals to, but yeah, it'll
Yeah.
be published by, encourage individuals to take a look at a really wonderful presentation.
Absolutely. The future is bright for sure. So, Pat, as you are going forward, where we talked a little bit about mentoring and coaching, and we have seen so many residents here. I mean, again, you're looking at the future of anesthesia. What are you most excited about working with in the mentorship programs of these residents that we're surrounded by?
So I'm very excited about the incredible quality of the folks who are going into the anesthesiology field, really in anesthesiologists, nurse anesthetists, CAAs. The quality of folks coming in is off the charts. And so that's very exciting to all of us. Then you get these folks who have this high capacity, this high energy, and then you give them the opportunity. You show them how leadership, how creating alliances with other organizations can help further anesthesiology as a specialty and also help our patients as a population. So we're going to try to be with them along their journey, to support them, to show them things which will make their career more enriching and more valuable, not only to their patients, but to them also. And as a society, we want to be there with them for their entire career and help them through that journey.
Yeah, a great opportunity to call out the great work that Patrick has done in this area, really pouring into
Yes.
younger anesthesiologists and those individuals in training and coming out of training. He has a high level of commitment, helping those individuals flourish at that point in their career arc, which is really critically important. So
Thank you. One of the things we like to do is to talk with resident groups about the importance of leadership, but not only the importance of it, but maybe highlight some of the elements that traditional medical education does not
Yes.
educate you
Yeah.
enough to be a physician leader, that you need to understand what it takes to go from being a physician to becoming a physician leader, and how can we help you along that journey.
Yeah, that's fantastic. Well, congratulations, and we wish you the best of luck on your upcoming year. Any other thoughts that you want to share with our listeners?
No, we're happy to be with you folks here today and support the discussion here, and we want to continue the discussion because, of course, healthcare and especially anesthesiology is not a static field. It's important for all of us to consider the issues on an ongoing basis, work with all of the folks who work in our field, and we're happy to do that. Thank you for
That's
having
great.
us.
And Don, and sorry, I was going to go to Don here too. As you, we wanted to commend you on a wonderful year of leadership here at the ASA, and wanted to give you an opportunity for some parting thoughts.
Well, thank you. It has been a great year and an incredible privilege for me to serve in the role that I've had. But really, the credit to what we've done as an organization goes to individuals throughout the depth and breadth of our organization. Individuals, staff members, physician members, physician leaders succeeding in the way they contribute within the ASA structure. And it's been just wonderful to see from a different viewpoint how all of that works.
Yeah, that's great. Well, gentlemen, congratulations. Thank you again for coming on Top Men Talk and chatting with us this year.
Thanks you. This is always one of our highlights, getting the leadership here, and we thank you for your service. You've done a great job with the ASA.
It was great to be here and spend time with you again.
Yeah, cheers. All right. Thank you. And thank you for listening to Top Men Talk. You can always find us at topmentalk.com or on your favorite social platform or on your favorite podcaster. If you find us, give us a thumbs up and give us comments. What do you like to hear? What you'd like to hear more of? And we especially want to thank the ASA for the support. This is our 5th year working together. So we truly thank you for supporting us.
Great.
Thank you so much.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe. Check us out on YouTube and, of course, on social media. We're on Instagram, Facebook, and X. Also, it's important to remember that Top Med Talk is the broadcasting arm of EPPOM, evidence-based perioperative medicine. We'd love you to find out more about that, and the way to do that is eppom.org. Check out our website and find out about some of the incredible conferences we're going to be arranging across the year. eppom.org.